I'm Dr. Clive Fernandes. I am the Group Clinical Director for the group and oversee all activities related to clinical, nursing and quality. So some of my activities involve linking up all physician views, consultant views with the management, conveying to management the expectation of physicians and conveying to physicians the decisions and strategic visions of the management. I myself work with JCI, which is the premier body for accreditation across the world and in the US. My consulting experience with JCI has taken me to 20 countries. I've been doing this for 7.5 years, and so I've had an opportunity to look at healthcare practices and quality practices across the group. That helps me leverage my experience and implement things in our group hospitals and in our country. I also look after quality. I have a team of Sister Rani who has been here with the group for a long time. She's got diverse experience. Apart from quality, I also oversee nursing. Nursing in our group is headed by Sister Susanna, who has varied experience of over 30 years in nursing. We have a very strong association with Harvard's, which has been there with the group for the last 10 years. This is something unique that we have done that I have not seen in any other health provider in the country. The association with Harvard is an important association, and it was strategically taken not now but 10 years ago, and today we can see the fruits of that. All our nursing second line leaders, all our nursing heads at units are not people we have got from out. These are people who have grown through the ranks. They've joined as nurses, they've worked here for 3 years, 4 years, they've got that experience of managing the department, and today they are heading the units in each of our locations. Having a network of hospitals has benefited us in terms of experience and expertise. We have been able to use technology to our advantage. Over the last 1.5 years, by the use of VCons, we have linked our physicians across specialties and formed something called the advisory board. Now this is different from a knowledge sharing group where you just talk about something. In these forums, our clinicians talk about the exciting and interesting cases they have done. They take opinions from their other peers. What is it they could have done differently? What is it that they done well? And believe me, when someone from your specialty, when someone from your group acknowledges and says you have done a good job, it feels good. So I've seen over this period of 1 year how these groups have evolved. Today we have our physicians trusting each other. They talk to each other about the case, they talk about what they would like to see, what they would expect, and they get good answers. So this is something that we have done over the last 1.5 years. We have done it across spectrums. We have done it for cardiology, we have done it for neurology, critical care, orthopedics, and we plan to take it to other specialties too. We are also going to use this association with Harvard and link our physicians through these boards, the advisory boards, to Harvard. So somewhere down the line, maybe after 6 months, I am looking at our Wockhardt group of cardiologists discussing interesting cases that they do here with cardiologists at Harvard. So we are going to have a lot of knowledge sharing going forward. We at Wockhardt believe that we do not have to do anything for an accreditation purpose. We believe we do this because this is the right way to do things and this is what benefits our patient. So we have a quality department in every unit. On a monthly basis, we review more than 150 parameters. Now believe me, when you talk about accreditations, when you talk about NABH, when you talk about JCI, there are not so many parameters that are reviewed, and it's just a visual review of the data. When we do quality reviews in our units, we go down to the units, we validate the data, we look at whether it is making a difference to our patients. And an example of that would be all our hospitals, all 5 of our hospitals which are located in 2-tier cities are all NABH accredited. Now it's easy to have an accreditation in metro cities, it's easy to sustain an accreditation in metro cities, but to have an accreditation and to sustain it in a 2-tier city, is tough, and I am happy that the team does a great job. Today I can proudly say all our hospitals are accredited, and all our further acquisitions too, we have a vision that we will be accrediting them. Healthcare, the way I see it moving forward in the next 10 years, it's going to become more demanding. They would like standardization, they would like efficiency, they would like everything done at the least possible cost. 10 years down the line, I think there's going to be more credit-driven business than cash. And if we look at the West, there are a lot of sanctions that the credit industry puts on hospitals. If a patient comes in without an infection and gets one in the hospital, they don't pay for it. You have to pay for it. So looking at it, I think a hospital needs to pull up its socks, because 10 years down the line, things are going to get tougher. We're going to have a lot of work done in stem cells over the next 10 years, and I look at that as the next thing happening in the healthcare industry. As consumers and as patients, I believe we all are becoming demanding. Something that I get today, 2 years down the line, I would expect that to come to my house. And if you look at it with regard to healthcare, I would not like to come to the hospital for a sample, blood sample, or a medication or a vaccine. So as I look at it, 4 years down the line, there is going to be a lot of focus and predominance on daycare and home health. And that's, I think, where we all, the healthcare leaders, would need to be looking now as the next big thing in the industry. We at Wockhardt have a very firm belief that we don't need to do things for protocols. We don't need to do things for accreditations. We don't need to do things because somebody says you need to do it. At Wockhardt, our philosophy, our belief is clear. We do things the way we do it because we believe that is the best for our patients. At Wockhardt, life wins.